Hello everyone, I'm Asha. I'm an emergency medicine doctor in UK. When I introduce myself, many people ask me a question. What is emergency medicine? Why you took emergency medicine as a specialty, or why don't you choose a general practice? It might be much better for you. Or I would make a better gynecologist instead of an emergency medicine physician because I'm a female. I face these questions daily on a regular basis. So I just thought, let me tell people what is emergency medicine is. Maybe this will help to them to understand better my profession. So it is a small attempt to reach the people who are interested in knowing about emergency medicine or a lifestyle of an emergency medicine doctor. Hope you will like this. If you like it, please click the bell button, share, and subscribe. So, what are we waiting for? Let's listen to my story. So, let me first explain what is emergency medicine is. Emergency medicine is a branch of medicine who cares for illnesses or injuries which need immediate attention. For example, it could be as simple as a patient coming with a headache, stomach pain, or chest pain, breathlessness, or it could be a cardiac arrest, a respiratory arrest, where the patient is dying and needs an immediate attention to resuscitate him and survive him. So it varies. You never know as a ED doctor what comes through the doors. It could be anything and everything. Nowadays there are many videos and many programs based on ER doctors, and there are programs and ambulance taking the sick patients to the ED. So I think most of them know about it, but still there are some group of people who don't know the true value of the emergency medicine, or there might be some people sitting out there and trying to understand what emergency medicine is, uh, what is it like attending an A&E as a patient. So I'm here to explain that process, and I'm here to explain my life as an emergency medicine doctor. So hopefully it will help at least those people who are interested. If you're not one of those person, please share this video still to reach those people who are interested in it. I Why I took this emergency medicine as a job. I like emergency medicine because it is thrilling and exciting not knowing what coming through those doors and still trying to establish and help the patient in their course of illness and make them better. We might not achieve 100% success in all the patient. We might not know the diagnosis. We might not know exactly what is the cause for their illness, but still we will be prepared to care for them. We'll be prepared to treat them. And it is not like a single branch of medicine where they will care for example, a cardiologist only see a heart patients, where a respiratory physician will only see the problems, breathing problems, or the lung problems. Coming to emergency medicine, we see everything and anything. It is one branch which brings them all together. It is very important in life of a patient, the first 1 hour of their illness. When they come into the A&E, if you don't get the things right, it might not have a good outcome in outcome to their illness. So it is very crucial to assess them properly, diagnose them, or investigate them to get to the diagnosis what we are thinking is most possible. So it's very crucial to have good emergency physicians. Nowadays, most of the younger generations don't like emergency medicine because it is a hectic job in their point of view. You have to do a lot of night shifts. You have irregular, abnormal pattern of shifts, which might not suit your lifestyle. So they like to have a easy lifestyle. That's why they prefer a GP over emergency medicine specialty. But it is not Just about the timing, sometimes you might feel very stressed and overwhelmed in situations where you don't know what's happening and you are trying your best to get the things right, but still you might end in a conclusion still not knowing what's happening. So it will be stressful at times, but still there's so much enthuse, so much excitement when you care for a sick patient and the patient gets better. You see an asthma patient who is suffering with breathing and comes into ED, and you give him treatment, and within few minutes he gets better, his breathing gets better, and thankfully he doesn't need admission and he goes home. That makes you feel a lot better when you see such patients. So I like doing emergency medicine because you can see that instant response in the patient sometimes, and you can make change to their life. It's not an easy job, but still it is more satisfying job. I I will explain more about what happens when a patient comes to ED. So first of all, when a patient comes into ED, he will book with a receptionist. There are two ways why the patient comes into the ED. One is like they are brought in by an ambulance. The other way is like they register, the GP sends them to the ED, or they walk into the ED and they book with a receptionist and wait for the triaging. Initially, when they enter into the ED, the triage nurse will assess them and screen them whether they really need an emergency treatment, or they can go to the GP center or a primary healthcare center, or can they directly streamline to the speciality so that they don't need to wait for someone to assess in the ED, because their symptoms are so clear, and it is like they can be benefited by seeing the specialty directly. Once the triage is completed and streamlined, they will be allocated to a bed or sometimes to a waiting area if they can wait to see a doctor, based upon their general condition. Again, based on how sick they are, their allocation will be. Once the allocation is done, they'll be wait for the doctor to come and say. Meanwhile, a nurse or a HCA or a social worker will attend them and try to do some observations, do some blood tests, do ECG, do ECG of the chest, so, or a urine test, and the doctor come and see the patient. When the doctor sees the patient, he will assess, he'll ask some questions, he takes a good history. He might ask you a lot of questions. It might be annoying for some patients to tell the history repeatedly, like to the triage nurse, to the nurse who is taking the observations, and to the doctor again. But remember, this person is seeing you first time. He or she would like to listen from you what is your problem, because you can tell your problem better than anyone. So be patient when you get asked repeated questions, and understand that this is for your own good and in your best interest why you're being repeatedly these questions. Maybe sometimes you might miss some of the facts in the first instant when you're explaining the triage nurse, but you might get them right and you can tell them in right order to the doctor when they repeat that questions again. So please cooperate with them and repeat the history. Once that is done, they'll examine you and they will try to establish your cause for illness. And if they think it is not serious enough, and if they think you don't need any specific treatment, they might advise you and guide you based on that. But if they're concerned that there are anything serious going on, they might decide to do further investigation, or if you think that you're too unwell to go home, might admit you. So this is the general course of a patient who is attending to the ED. Hope this helps. I'm just trying to explain this video generally what happens with a patient who comes into the ED and what does the ED doctor does. So, hopefully, this video might help many people who don't know what emergency medicine is, um, what happens when they attend E-Day. So, I just try to describe this. In my next video, I will explain more about my life as an emergency medicine doctor. Hopefully, we'll see you again soon. Thank you. Bye bye. Until then, keep watching for my videos. Like, share, and subscribe. Thank you.